Today we will be demonstrating a stuttering therapy technique called light contacts. When a person brings their articulators together with a hard contact, meaning with a lot of tension, this can trigger stuttering. A client who has this tendency can be trained to produce consonants with light contacts instead. This is first taught by the clinician modeling a relaxed style of producing consonants with a constant flow of air or voice depending on the consonant. The clinician's lips during the modeling of P will actually not touch when she models this plosive. It will sound more like a fricative, so in the word pink, it will sound like pink. In this video, we will demonstrate how the clinician teaches the client, a 7-year-old girl, to use light contacts in her speech at the single-syllable word level. You will see how teaching light contacts can actually start off with demonstrating the idea of barely touching by using a musical instrument. And once the client gets the hang of using light contacts in speech, so not in this video, the clinician can combine flexible rate, easy onset with light contacts.
Today we're going to be talking about a technique called light contacts that will help you with your stuttering.
Okay.
You know, sometimes when you have a word in your mind that you want to say, but you know you're going to stutter on it?
Yeah.
That's the perfect time to use light contacts. Let me show you what I mean by demonstrating on this xylophone.
Ooh.
I want you to take this and hit the xylophone as hard as you can.
Okay. Oh.
There you go. That was a really hard contact.
Mm-hmm.
Now I want you to barely tap it so you can not even barely make a sound. Good. Did you feel how that was a lighter touch, a lighter contact?
Yeah.
That's exactly what I mean. So now let's try with your mouth. Take this mirror here and look in the mirror and tell me what part of your mouth you're using when you say the P sound.
My lips.
Good. So today we're going to practice light contacts with our lips.
Okay.
So I'll demonstrate first. I'm going to say the word pink, but instead of pushing my lips together, I'm going to barely tap them and let the air sort of continue to flow out like this. Pink.
Pink.
Good. Did you feel how the air kept flowing?
Mm-hmm.
You can also try by putting your hand in front of your mouth. Pink.
Pink.
And you can feel the air continue to flow out.
Mm-hmm.
Did you feel that?
Yeah. Pink.
Good. Now try a hard contact. Pink.
Pink. Oh, that was so different.
Yeah, very different. And how did your mouth feel, your lips feel when you were making the light contact?
Like, kind of loose. My lips were loose.
Good. They were less tense and more relaxed. And if you noticed, you didn't even stutter.
Oh, really?
That's right. So now we're going to talk with Julie's mother
Hello.
about how to generalize this at home. Hi.
Hi.
So today I taught Julie a technique called light contacts,
Okay.
meaning with the letter P, we work with our lips on barely touching them together like this. Pink
Okay.
instead of pink.
Mm-hmm.
Okay. So at home, first, I'd like you to help her use a mirror to practice the light contacts so she can look in the mirror and barely touch her lips together when saying pink.
Okay.
Or purple, or some other word that starts with P. And next, I'd like you to use these words I wrote for you, and you can come up with any other words that start with P that she has particular trouble with.
Mm-hmm.
Shorter words are best to start out with.
Okay.
Okay, so when you hear her using these words in regular speech, if she has trouble and stutters, you can remind her to use her light contacts.
Okay.
And third, I'd like you to put this list up on your refrigerator, and when Julie has trouble saying these words, remind her to use her light contacts, and once she's able to say the word without stuttering, she can just cross the word right off the list.
Oh, she'll love that.